that she's taken some time from her extremely busy schedule to be here with us today to share her personal caregiving story with you and also to talk about some of the legislative priorities and some of the advocacy issues that are being worked on behalf of caregivers. So with that, I'd like to open the stage to Representative Conlon. Thank you again so much for being with us. You have such a powerful story. And what we really appreciate, Representative, is that you're so willing to share it and to advocate for caregivers throughout the state of Michigan. So thank you for being with us.
No, thank you, Paula, for inviting me and for AARP, letting me share my story and let me be a part of this community. I am 63 myself, so I'm part of this community. Yes, so I represent parts of Washtenaw, Livingston, and Jackson counties. I'm starting my second term, but the way that I really became involved with AARP is through my own personal story, beyond the fact that I cared deeply for seniors in general. I have, for the last 15 years, lived with my mother and my father until he passed away right before COVID. Before I did this, I was a journalist and we'd lived abroad for a while with our three children, and we moved back 15 years ago. And my dad was in real estate, and it was a horrible time in 2010, and they were going through a very difficult financial time. And we were coming and restarting our lives after 20 consecutive years overseas. And we ended up moving into their house, purchasing their house, but with them in it. And to be fair, to be honest, my older brother lives here too. So I am in a very multi-generational situation. My dad passed away right before COVID, but my mother is doing extremely well at 91. And my children are now grown and on their own. So we're down to basically my husband, myself, and my mother and my brother in this house. But it is a lot to be a caregiver, and it is a lot to have decided to run for office. It was a big, moment for me to decide to do that because my mother has a lot of mobility issues and relies quite a bit on me. So I am the most fortunate because my parents, even though they ran into financial difficulties, they had decided to get long-term health coverage. So I have some help in the mornings with my mother, who right now is at a doctor's appointment with one of her morning caregivers. And then basically they leave, sort of midday. And then I'm the one who sort of, takes over in the evenings. I have a sister who lives nearby who helps out. Obviously, my brother's in the house, so he can help. My husband's like a saint because he helps. But it's still always on my mind, right? Even when I'm in Lansing, sitting on the House floor, and it's time to vote, I'm checking my phone a lot to make sure my mother's okay. She's got a health alert. So if she is home alone and something happens, we know very quickly, thank gosh. But I'm not going to lie, it's like a whole nother job. So I get back here, I have to make sure she has all her medications. She has a stair chair that takes her up and down. But, we have power outages that can affect her stair chair. I do talk to DTE about that now and then. And, I just have to worry about, like, has she eaten anything? Has she seen anyone that day if there aren't caregivers around? Because I do have evening events, so I kind of try to rush home and make sure she's okay before I get back out. And even now, I'm going to we are on a break from the state legislature. I'm going to try to go visit my children on the East Coast. And it's a lot just to organize for me to be gone for 5 days. Obviously, the benefits are incredible. I get to see my mother every day. Her mind, I'm so lucky, is in great shape. She's just very immobile. And I was saying to Paula that I guess it was a few weeks ago, I heard that they might end the telehealth program for seniors on April 1. And I thought, I'm not going to even tell my mother. And of course, I walked in the house and she had heard the news and said, is it true? Is this going to happen? Because right now she's off at, on a day where there's no ice on my driveway, no ice on the steps with her caregiver to her doctor's appointment. But normally things crop up, she has a rash or she has she has some gout, she has this problem or that. And we do the telehealth. And there was one time when that wasn't possible about a month ago, but the ice was just so extraordinary and I had to get her in person. And I pulled the car up as close to the front door as I possibly could, but she was terrified of slipping. And I can't imagine that we won't have that choice and that I might have to be worried about, and she feels more comfortable going in the ice with me than a caregiver because she is, more comfortable having me hold on to her. So it's a lot of challenges, and I'm hoping that doesn't go away because that'll add a whole nother challenge. But I appreciate so much the caregivers who help me out, the caregivers out there, everybody who's in this situation. And I know I'm more fortunate than some because she does have this long-term health insurance, and I do have family members nearby helping me, and these caregivers.
Thank you for that, Representative Khan. It is still quite a journey, 15 years. And I know that we'll talk with Jack, we'll bring her on in just a moment. But in 15 years of doing this, you don't even realize the toll that it takes on caregivers because we just do what we do, right? I mean, we don't stop and think about ourselves. So we want to talk a little bit about that in a moment also. It's not that you'd have it any other way. Thank goodness that you're able to keep your mom at home, your loved one at home. Home and community-based services, ARP advocates for more of those all the time, so that more people can age in place, which is where they want to age in their own home. So there's just a lot that we have to talk about. And again, to our listening audience, we appreciate you calling in or being on this program. And we're going to get to your questions in a moment. But I want to, before I bring on Jacqueline, I want to encourage Dr. Howe, I should say, I want to encourage all of you to please feel free to share your personal caregiving stories as well. And we'll talk about where you can do that, or a way that you can do that in just a moment. But right now, I'd like to introduce to you Jacqueline Howell. She is a board certified family nurse practitioner and clinician health specialist at Oakland County Health Division in Southfield. Since joining OCHD in 2019, she has developed and expanded HIV prevention programs and established partnerships throughout the state. Jacqueline graduated from Michigan State University with a Bachelor's of Science degree and earned her Doctorate of Nursing Practice from Wayne State University. Her doctoral studies focused on evaluating the outcomes of a national nutrition education program. She's also a credentialed HIV specialist through the American Academy of HIV Medicine. Dr. Howell, thank you so much for being with us today. We appreciate you. We always appreciate working with Oakland County and also working with Wayne State University and with the health department and anyone else that has the same agenda and the same focus as AARP. Thank you for being with us.
Thank you for having me.
So would you please share with us some of your background and experience in terms of this caregiving journey that we're talking about?
Sure. So, by trade, nurses are obviously one of our biggest, professionals in our workforce environment. And medical care, 60% of um, medical professionals are nurses. So, by trade, I am a caregiver, but I'm also a new mom. I'm a wife. I have two parents, so I'm a caregiver in all aspects of my life.
And what are some of the common stressors or emotional, physical, and financial stressors that you see caregivers go through?
I think first and foremost is there's biggest stressor is like how do you even navigate this process as a mid 30-year-old person? What is that going to look like when my parents are older, and what's the first step? They live in North Carolina, but my brother's there, so do they even have all the paperwork ready to lined up? Do they have all the savings? That's a huge stressor. And like Jennifer had said, taking time for yourself. Um, Financially, just are you prepared to take care of aging parents as well as your young kids and yourself? I just don't think this is talked about enough in terms of what's the process moving forward. Do you even go about getting ready to do this kind of thing?
So, as a caregiver and as someone who is a nurse practitioner, what's the number one issue when people are hospitalized or institutionalized? What's the number one issue that they're facing when they know that they're going to have to be a caregiver? Is there a number one issue, or is this multiple issues?
I think there's multiple issues. Generally somebody's hospitalized and not ready to go home. They're sent to a nursing home, and that's generally not a great place to rehabilitate or recover. And then they're forced to go there, and then their kids who are working are have to figure out how to balance all of that. And then how are they going to transition getting home? People are lucky enough to put elevators in their house, but not everybody's that fortunate.
And when you talk with caregivers, or when what are some of the questions that they should be asking of their medical professionals? What are questions before they even leave the hospital or before they go home? What are just two or three things that everyone should be asking?
I think knowing about medications is important, making sure all the medications they, might currently be on or new medications that are on are interacting, medication reconciliation, making sure there's not something that could be dropped off or added on. Safety is the house safe? Are you going to have, an occupational or physical therapist come in and do some sort of, look at the house and see if handrails need to go up or shower bars, or how are they going to get up and down the stairs, or how do they get up and down the front porch, things like that from a safety perspective. And then, what resources are available to you to navigate this process? Can you afford having in-home nursing care, having a physical therapist come? And then, what about respite care? How do I take care of myself as I'm taking care of somebody else?
Yeah, those are all important questions, and we know from some of our research and surveys that the average caregiver spends about $7,200 out of their own pocket every year to take care of a loved one. And when it's dementia or some other form of dementia, that number goes up to over $9,000 a year just to make certain that the home is safe. But I always like to add this caveat to that statistic, and that's the fact that we still save the state of Michigan money when we take care of people in our own home because you look at Medicare, Medicaid, and other areas. So we're still saving money for the state. So that's why we being AARP advocate so strongly for home and community-based services and to reallocate more funding to home and community-based services. We'll talk about that with Representative Conlon when she returns as well. Um, you have you have a very storied background. You've done some wonderful, wonderful work throughout your short term. I say short term because you've been at the Department of Oakland County Health Division for not that long, not as long as I've been around. I've been around. What are some of the things that you have that you're most proud of in terms of the work that you've done?
I came on so right before COVID, and I work generally with younger people, mostly men who are at risk for HIV. And I created a program that now serves over 350 individuals at preventing HIV, which then has a trickle effect because if they're being prevented against or protected against HIV, their partners. And then I'm also super proud of starting and expanding a hepatitis C treatment program, which absolutely affects a lot of older adults. A lot of people don't know that they have hepatitis C. So it's just amazing to prevent and also treat these horrible viral infections that just, really can take over someone's life.
Absolutely. Well, thank you for that, and thank you for that work. I know that I'm reading your bio. I know that you were very instrumental in developing that program. So thank you so much for that. And people don't often know that. I think the fastest rising area of sexually transmitted disease is in older adults, not young people as much. And so that's could potentially be another caregiving issue for some folks. So let's bring Representative Collin back on and let's have some discussion. And then again, if you have questions, you're listening to this program, you have questions, please put them in the chat. But I'd like to, Representative Collin, we talked about home and community-based services, more dollars being allocated for home and community-based services. We've talked a little bit about retrofitting homes, whether again shower bars or widening doorways. Uh, Anything being done in that area from the state legislature that we should know about?
Well, I have kind of a long list of things that were here. We have the home health program,
Mhm.
and that was funded for the last year's budget. 2025 was 593 million, and the year before at about 541 million. So we're hoping those costs are likely to increase, as the Home Health Caregiver Council is set up, which I think is happening. So that's one area. Specifically, I don't know of exact legislation around that. I can tell you what we have been working on, which is a bill that I had the last term that I'm hoping will continue to be moved with one of my Republican colleagues, which is to cap insulin for everybody in the state of Michigan who's on Medicaid at $35 a month. So that would be, help with Medicaid Part D. So That is something they've done at the federal level, as we know, for people over, I think, 65, but we would want to do it for everybody in
Yes.
the state of Michigan. Um, and also, I know you support AARP, and we do support Drug Affordability Board to look at costs of review our drug prices. That right now is sitting in the Senate. So it's been reintroduced and is waiting committee. So maybe that will get moved. Governor Whitmer, in her budget for the coming year, for 2026, has put in a $2 million increase for the Dementia and Healthy Brain Unit
Mhm.
within DHHS. Obviously, we know dementia is a chronic disease, and we have to really take that seriously. Yeah, and then in terms of other things that I was told to point out, obviously, you all support increasing access to affordability and broadband, reliable broadband, which is huge. That's something that I think is on the agenda to look at. And age-friendly Michigan, ARP, we know you support this, increasing affordable and accessible housing for older adults. So housing, I think, is one of the things that we really know has to be addressed for both ends of our age groups. Younger people, we need to come in and join our workforce, uh, if for no other reason to take care of the older people as we leave the workforce. Nobody has housing. Like, people aren't leaving their bigger houses because there's nowhere to go. And the families can't move into our bigger houses because we're sitting in them. I mean, obviously my house is very well occupied, so I'm not moving out of it anytime soon. But I think there are some others who are empty nesters and just can't see any affordability of downsizing, which is strange, right? And then our younger workforce are coming in and having trouble finding housing across the state. So we know that that's a huge issue that we need to be really focused on.
Absolutely. And Jacqueline, what do you say to people? Does the medical profession say to folks when people can't go home because they don't have a ramp or they don't have, access to the doorway? What alternatives are there for them?
Uh, Not very many, right? And with a friend, like a nursing facility, trying to find a workaround, or they're stuck in their house, right? People have to come to them.
Another area that AARP advocates for because of the expense, and it is expense. I mean, you share your story, Representative Collin, and you have a nice support group with your brother and others there, but a lot of folks don't. And so when they spend that $7,200 out of pocket, to make the accommodations to the home so someone can come home and live in their house where they want to live. And when they keep someone from going into whether it's a nursing home or some other type of institution, they actually save the state of Michigan money. So AARP has been trying to advocate for a caregiving tax credit just to give people $3,000 back or tax some amount to help subsidize that. Because if everyone went to a nursing home or some kind of a health care or long-term care facility, it would cost the state of Michigan through Medicaid and Medicare a lot more money. I think that the number is something like for every $2 spent to send someone to a home, you can save, for every dollar spent, you can save $2 by keeping them at home. For every dollar spent, you can save two. So for those who are listening, help us try to advocate for the things that Representative Collins just mentioned, everything from lowering prescription drug prices to PDAB, a drug affordability board, to look at the cost of prescription drugs. I'll never forget the story in my 10 years of being AARP of a woman who sold her wedding rings in order to pay for her husband's prescription drugs. And they had been married for like over 50 years. It still breaks my heart. She's deceased now, but that's what people are doing, and we don't hear their voices that often. So we certainly want to hear your voice today if you have some questions. And there's one question that just popped in. It says, "What can I do um, for legal? What I'm sorry. What legal documents do I need to have in place to make decisions for my dad if he can't anymore?" So does anyone know what answer? I want to answer that question. I know you're not legal experts, but any suggestions on, like, well, you've gone through that, Representative Collin, because you probably have
Yeah,
colleagues.
I mean, my older sister's so good about this because she knows this whole world better than I do. But I know we have in place, obviously the living will and the is it called the do not resuscitate. Having said that, when we lost my father 5 years ago, they don't kick that in if they can reach you. And
Mhm.
so even though he didn't want anything really done at this point at the end of his life, he had an episode in the middle of the night after a surgery that didn't go well, and they probably could have done it then and just let him go, but they reached us, and once they reached us, we came in, and that was sort of then. He lingered on another week, but I don't know. The do not resuscitate is also interesting to us because when does it really kick in? And that's probably more information. That's something we need to research with my mother, now 91. But no, we have that in place. I have on my refrigerator her medications listed if a first responder has to come. Also, all the emergency contacts. So if I'm not here or caregiver isn't here, there's and she calls for help or her health alarm goes off and they come, they'll be able to see everything right on the fridge. So that's in place, and I think that's mostly what we have ready for her is those kind of documents.
Thank you. Jacqueline, anything you want to add to that?
And I don't know if you mentioned like durable power of attorney, medical power of attorneys, making medical decisions for her.
We have that too. Yes, we do. We did get the power of attorney for that in case she's unable. Mm-hmm.
Yeah, and I do believe in it. My grandma had really bad dementia, and I think there was a requirement that she had to see 2 different physicians to basically, concur that she was not able to make decisions, so that legal paperwork decided to give it to one of her children.
And one of the things we hear all the time too is that people get the legal documents, but they don't have the passwords. They forget to ask for passwords to have access to some of the the information that's online or at the bank or whatever. So AARP has a whole prepare to care book, and you can find some of this information, these resources on AARP. It's aarpmi.org/care. aarpmi.org/care. But it's called prepare to care. So even before you need a lot of this information, just have those kind of conversations about what would be needed if I'm not able to make my own decisions, and who do I want to make those, and have those conversations so you can start writing that information down. I know people are, particularly older adults, they don't like giving out their personal information. I don't like giving out my personal information, but hopefully to a trusted friend or writing something down somewhere and sealing it and having someone open it at the appropriate time.
Mm-hmm.
We all heard and read about the story of Gene Hackman, right? And what happened with him when his caregiver had died, and no one knew exactly what was going on or where the information was or any of that. So there are lessons all around us. We just need to make certain we heed them and take advantage of what we know. There's another question here that I see here. It says, my mom wants to stay in her home as long as possible, but I don't know what kind of help is available. What are my options? That's a tough one.
I can answer that of what I've found. So, there are caregiving agencies. I used one right at home. There's a bunch of them that you can contact and get sort of an idea of what they charge for you to have somebody come into the home. We now are no longer using that agency because we found another caregiver who had worked for one of my mother's neighbors' friends who passed away. And I hate to say it, but when someone passes away and has a good caregiver, I was like, what's happening with the caregiver? So we have been lucky to have that person come in, because to be honest, we had the same caregiver for my mom for 5 years who came in during the day when I'm not around. And she got in an auto accident and now could not be a caregiver herself anymore. So that required switching things up. And my mom does like to have one person who she knows or two. And for a while there had to be like a different person every day, and that's not ideal. And so now we're back to a situation where there are 2 different people, and one is here the first few mornings and the other the second 2 mornings. And the weekends I take over. We don't have any help on the weekends. So so basically there are options out there. I think obviously we don't have enough people doing this work because it doesn't pay well and because it can be stressful. So that's why when we went through this interim period with one caregiver not able to come anymore, we had to bounce around and have different people. And that's just because of schedules, and a lot of the people who do this work are older.
How do you vet a caregiver? And that's a question for both of you. How do you vet someone? I mean, I know if it's a personal friend and had a caregiver, that's different. But if you're looking for a caregiver, how do you find a caregiver that you can trust and that knows what they're doing? What are some of the things they should look for? And both of you can respond to that question, please.
Yeah. Representative Collins, you want to go first?
You go ahead, and then I'll give mine. I'm talking too much.
Yeah.
No, you're not. It's great information. Thank you.
But I have a son, and it was similar in terms of finding daycare. What are your credentials? Is there somebody that you can talk to? Resources? Do they have any medical degrees? Any background? What is their experience? Things like that. And also, I feel like a gut feeling. You can kind of tell if is this person going to take care of mom the way I think I would want her to be taken care of. I do have a friend that set up cameras in her home. I know that might be an invasion of people's privacy, but at some level, it does kind of keep people responsible. So that could be an option too if that's something somebody could afford.
And that's a challenge because a lot of folks, I remember I worked with a gentleman, he was an executive, and his mother did not fire the caregiver because she didn't wash her hands right before she did something. And so, she was helping in the house, and she said, "Get out, get out." And she said, "What did I do?" It's like, "You didn't wash your hands." I mean, older adults pay attention to what's going on, and many times if you don't have cameras or things in your house to see what's happening, you don't know what someone else is doing. So the vetting and the question about vetting and knowing that you have a good, caring caregiver is really important. Representative Conlon, your response?
Yeah, well, I mean, obviously, when you go through the agency, they've done the background checks
Right.
on people, but it still doesn't matter. You still want that person to, understand and get along with your relative that they're going to be taken care of. My dad had a caregiver just only the last 6 weeks of his life, and so that's who stayed on with my mom. So that was so fortunate because she kicked in then with her long-term insurance because she'd had a horrible leg injury and really was having trouble moving. And so Maria knew not only my dad, but my mom. So that was a really nice thing especially during that beginning grieving period for my mother, that she was with somebody who'd known my dad. But she just turned out to be great and fabulous. And there was a lot of rapport between them. And then in this last instance, again, I had her come over and meet with my mom, and my mother, because she does have her mind, is the first person who can tell me if something's not looking right when we're not around, because she's mentally in great shape. Her biggest complaint about her newest caregiver is the food is healthier than she might like. They're bringing her beautiful mango fruit. She does have a sweet tooth, and I'm telling my mother, like, I'm really happy they're not letting you have ice cream and cookies all the time, even though you're but so yeah, so I think that obviously I don't have cameras in the house, but we have a very busy household with people coming and going, so there's that. And yeah, I just think there's a lot of intuition behind it, but certainly, when you go through an agency, they're clearing people too.
Absolutely, absolutely. And it's important to do that kind of vetting or go through an agency, or even if it's just a personal reference, just to still do some vetting and to check. And as Laura said in the comments, cameras are important and can be very helpful, are good as long as they are not hidden cameras. They should be disclosed in advance so the person knows that you are paying attention to what's going on in that house, and you can see that at any point in time. Just another point of a reference for the person who asked the question about how to find a caregiver. I attended an ARP national meeting, and some states are working with their universities and students who are in nursing program or any of the social sciences, students who are going into social services or any kind of human service and want part-time jobs it's a great experience for them. And they actually have a program where they're vetting and talking with students and they're on the list. So I know that I believe University of Michigan has that kind of a program. Michigan State University does. I don't have the exact name of it at the top of my head, but if you're interested, put it in the chat and we can get it to you. But you might want to check universities as well, because students can work 20, 30 hours a week, and sometimes, and it's for 4 years or 3 years if they're in that program. So sometimes that kind of consistency helps, and also the expense may not be as great as going through other, an agency or somewhere else. So, just another option for the person who asked that question. Thank you for that. This person is saying, I am. My husband has fallen a couple of times at home. What are some simple things I can do to make the house safer? Wow. Um, like,
I can add a lot on that.
okay.
I just walk around it's sort of like, as Jacqueline would say, with young children, it's the same on the other spectrum. I'm looking for trip hazards everywhere. If I drop an ice cube in the kitchen, I clean that up because I'm worried that could be a slip zone. If she comes,
Mhm.
she can kind of come down in her stair chair and make her way to the kitchen, which is maybe 20 steps with her cane, sort of. But
Mhm.
but that's kind of holding on to things. Her mobility is really not greater than that. And
Mhm.
so I'm looking for that. We're looking, we've replaced toilets so they're higher up so that there's not a fall getting up and down from doing your business. And she really I'm just always making sure that there are clear pathways, for the most part, because she has fallen. She fell on the driveway a couple of years ago, which was very scary. Thank God um, my firefighters, my wonderful people showed up within moments of my calling, but she did have a pretty severe head, wound.
Mhm.
And that was just her tripping on, like, I don't even know, like on the driveway, just like uneven pavement.
Mhm.
So I hold on to her. She really doesn't walk anywhere without me on the other side of her with her cane. She doesn't want to walk on her own like that. So it's kind of like everywhere. I'm just looking around my house now. I have two dogs, so I make sure that their dog bowls are out of the way, and it's like
It's a lot, isn't it? It's a lot.
well, a friend of mine came up with a great analogy whose mother lived with her, which is, I don't know if you've ever seen that Olympic sport where they make the ice so curling. The ice is clear so that the puck can make it down and you skip along the way. And so she and I would say, like, yeah, heavy curling this past weekend, because you have to make sure everything is smooth, like from getting off that stair chair to getting into that car
Yes,
to getting, if I'm taking her to dinner somewhere or whatever, everything has to be thought through to get her there.
absolutely. Yeah, there are. I mean, we have to, like said, that both of you said, a bit of intuition in terms of, scattered rugs and all of that. But Jacqueline, before I comment, let you go ahead, and you want to comment on that question as well.
Yeah, definitely. If there's animals in the house, making sure that, the animals themselves are not, in the way. Dogs like to lie everywhere. So making sure that, older adults are looking. This is similar with kids. Do they walk along furniture, grabbing dressers or stuff like that? You want to make sure that those aren't able to fall. So having them anchored to the wall, um, grab bars, and also like proper footwear. If your husband's repeatedly falling, first of all, why is he falling? Is it something that he's tripping on, or is he getting up too fast? Does he have orthostatic hypotension? Does he need to sit, at the side of the bed before he stands up, or sit on the toilet for a little bit before he stands up? Making sure that there's not medications that are interacting, and then making sure whatever he's wearing on his feet aren't causing him to trip or slip and then fall. So.
I appreciate that. Yeah, and I'm going to ask that we put this in the chat, but we also at ARP have something that's called universal housing, or like home fit program. And both of you are really emphasizing how important it is, not just for older adults, but even for young people, to have homes that are adaptable to growing families, whether it's the throw rugs on the floor or even grab bars for children and or older adults. What you do with the dogs and the pets, whether it's little children, whether it's older adults, those can all be hazards in the home. And so this universal housing, we're trying to encourage contractors as we look at housing. And you said it, Representative Connell, we need more affordable housing. But as we work with the contractors, I'm working with both the Senate, Senator Anthony, and also members of the House, to have a meeting very soon. It's coming up very soon with contractors, just to talk about universal housing and design for young and older adults, as we talk about affordable housing, so that people can age in place and that they can have access to their entire house without having to spend a lot of extra money in expense on that. So thank you for that question. Great question. Also, comment from Maria. She talks about not only having cameras inside the house, but also outside the house. She mentioned that someone got locked in their indoor garage, or they fall, sometimes inside of a garage or around the house. And those cameras outside for surveillance are also very, very helpful as well. And that is similar to the indoor camera, the Nest camera that so many people currently have, but they also need them for outside their home. Excellent point. Because people do like to, whether gardening or sitting on the porch or just walking around their house, or like they said, in the garage and something happens, taking out trash, that it's another good tool or good resource to have. A question we have here is this individual says that she's trying to juggle caregiving and full-time job, but she really needs a break. What kind of respite care is available, and where can I find it? Anyone want to respond to that?
Well, I mean, I know they're like, my mother isn't like as social as I'd like her to be, but that's okay. She can still read her books. But otherwise, I would certainly take her to like the senior centers.
Mm-hmm.
And I've been involved in the senior centers just as a legislator, helping get funding for the Dexter Senior Center and others. And so when that senior center opens, I am going to take her, because I'm very proud that we got that money for it to be opened.
Congratulations. Yes.
But there is a lot of there are a lot of programs out there. Even I know here in Ann Arbor, I've noticed at the geriatric center, I think there's some daycare, maybe memory care if you have that person who's really suffering mentally. So I would say look into that. These senior centers have everything going from, card games to making crafts to, doing chair yoga and all sorts of things, just to get them together. And they often have lunch for free, or a very small amount. And it's just an opportunity for you to get a break if you're the caregiver, while they're also getting an experience outside the home that hopefully is safe for them.
Absolutely. Jacqueline, anything you want to add?
I don't have any personal experience, but I know my aunt was involved in a support group for an aging parent with dementia. I made friends in there, and might not have gotten like care, but got the support just to feel like she was being supported. She wasn't alone, and kind of bounce ideas back and forth. And you could go so far as like, hey, I'll watch your mom like today, and I could watch your mom next week, or something like that. Just making friends who are going through the same situation. Maybe giving each other a break that way if a senior center isn't available in your area, because they aren't everywhere.
Mm-hmm.
Yeah, I will sometimes tell my friends if they have a parent that is living nearby or with them, to bring them over, and my mother calls it a play date.
Yeah.
That's great. And that socialization is important, and we've started the program talking about this as well. The caregivers need a break also. And one way mentally or just psychologically to get a break is to talk about what you're going through. So many times people just keep it inside. They don't want folks to know what's happening. Someone's had dementia or someone has another issue. They just like warriors. They just keep moving forward. But talk about it. Get in those support groups. Just talking about it, you can find other ways to get some respite care for folks. But the community centers are a great idea. If you have one in your neighborhood, in your community, please take advantage of that. And while they're there for 3 or 4 hours a week, you just go home and take a nap, or go do whatever, go to the movies, or do whatever you want to do for that period of time. But the most important thing is to reach out, share your story, talk to people, and find out what's available, because you're not the only one going through that. That's why we're having this program today. We're celebrating you as a caregiver and celebrating what you do, and wanting to make certain that you have access to some resources. So please visit again our ARP. I'm always terrible with our own websites particularly, but it's arpmi.org/care, arpmi.org/care. There are some resources on there as well. And there's a wonderful video of people telling their personal caregiving stories from all across the state. You can just click on different parts of the state and find that people are sharing their personal caregiving stories. So that's another way to connect to other caregivers who are going through something similar that you might be going through as well. So thank you both for the response to that question. Question that came up here is this. young woman says she thinks her mother's on too many medications and the doctor's not listening to her. I don't know if we can answer that, but what can she do because she thinks the medications are causing her more harm? Any questions or any comments or response to that?
Yeah, older adults generally have more than one provider. Um, so if you feel like you're not getting the answers, potentially trying to find a different provider to do a medication reconciliation and making sure that if they do have different providers, they're all aware of the medications that they're on. Sometimes certain doctors don't know what the others do, but they should be able to the list of meds and make sure that there's no interactions where they don't need to be taken at different times of the day or their dose needs to be increased or decreased. So if you're not getting the answers, be an advocate for, your parent. Say, I'm not taking no as an answer. And
Mm-hmm.
opinion. Or be pushy about it. I feel like this is causing her side effects that are harming her. I need you to listen to me and really sit down and go over these medications.
Absolutely. Absolutely. So,
Yeah, and I've seen the same thing. I mean, we ended up getting my mother, the doctor she's hopefully seeing right now is her sort of general geriatric doctor. And the idea being, and because I'm in Ann Arbor, we're obviously using Michigan medicine, but she also sometimes does Trinity as well. So I'm on both portals with her. My mother is not computer literate. I've taught her a million times. It's just never caught on. So we're there. We're giving up now. And so I do all of that with her, but I kind of manage her portal and I see what medications. And yeah, no, there's certain things she can't take that would help her because of she's got AFib and there's a lot going on there. But at least now I know that they're seeing everything because all the medications are listed when we have a new problem. But yeah, it's a lot to manage all of that. And she's pretty good at knowing what to take and when to take it. So I haven't had to do the pill box thing yet because she's got that down. But I imagine that will be coming soon because there's a lot of different meds she's on.
at 91, she still sounds like she's really sharp. So that's a blessing. That's not the case with a lot of folks, but that is a real blessing. So I'm happy to hear that for you. And also pharmacists are another good resource. Talk to your pharmacist about the different medications and what kind of reaction different medications might have. That's a no cost referral or a resource that you can use. Just talking with pharmacists and let them know. Many of them have more knowledge or as much knowledge about medicines and the impact that they have on each other than as doctors do, as much anyway as doctors do.
Well,
So
yeah, I'm going to say that when my local Rite Aid closed, that was the biggest loss to me because that pharmacist knew my parents, and for 15 years I could go in and ask any question, and she was so helpful. Knew every med my parents were on, knew exactly what they needed. Would refer me to the doctor if we certainly had to go that route. But like we just had such a personal relationship, so it was really sad for me when that happened.
absolutely. Thank you for that question. Mark has a question regarding driving. Says his father can no longer drive, and taking the keys has been a major concern. Any suggestions on trying to make certain that older adults understand that they can't drive anymore?
Yeah, they all think they can drive. My mother thinks she can drive. She just renewed her. She just renewed her driver's license. I do think, and it probably would be the most unpopular legislation, but I do think we need to have certain older adults take an actual driving test. I'm not sure they should really be able to renew their driver's licenses. Having said that, I know it's taking away their freedom if you do that. So I probably won't bring that legislation because my mother wouldn't talk to me. But
Thank you.
but having said that, she realizes now that she can't really drive places because she can't get out to where she goes. There can be an issue. Like, basically she'll drive to the grocery store and then unless she get the best place, she can't get into the grocery store. So now she's not driving because of the mobility issue. But I do think at some point I have so many friends who've just had to take the keys away. And it's not a simple thing, but it's just a loving thing to do.
Thank you for that. Jacqueline, anything you want to add?
I do not. Thank you.
Okay, one of the an area too is there's so many share rides, ride share that they have available now too. And if you can get older adults using that before they actually need to use it, it makes it much more comfortable. But I remember someone saying to me when we were little, your parents always told you don't get into the car with strangers, and so now we're telling older adults to get into the car with strangers. And then there's some of the bus and transportation systems have special buses that will take older adults to appointments, doctor's appointments, even hair appointments,
Yep.
or whatever. So check your transportation, local transportation authority, and also consider maybe a ride share with a friend, even maybe a friend might ride along with them in a car if a friend doesn't want to drive either. But there are a lot of other options that are available for transportation. It's just whether or not people are comfortable using those options, or whether or not they can use them, particularly if they are physically challenged and can't get in and out of a car as easily, then rideshare may not work. But there are some, again, local bus transportations that will pick people up. Transportation companies will pick people up and take them to doctor's appointments. So, Mark, please check that out, and hopefully you can find someone, someplace in your community that might help with that as well. The next question came from a person named Alicia, and she says there are too many uh, I'm sorry. Medicaid is confusing. How do I know which? Let me read this correctly. I'm trying to read the. Okay, Medicare and Medicaid are very confusing. How do I know what coverage is available for my loved one? I'm very confused about both. That's the question. Medicare and Medicaid are confusing. How do I know? How do I figure out what they cover for my loved one?
I would let Jacqueline answer that.
Yeah. So, Medicaid is issued by the state, whereas Medicare is federal. So, MI Bridges is the website you go to enroll somebody for Medicaid. They are very difficult to get on the phone, but if you are able to sit and wait, um, they'll tell you there's, Medicaid navigators that can walk you through what they cover. And then Medicare, I'm not as familiar with. Um,
It's a federal program. And we have a number. If you want to call, Alicia, if you want to call our office or email me at pcunningham@arp.org, I can give you a phone number for the Medicaid office locally through the AAA, Area Agency on Aging. They have people who can really help walk you through what's available. So if you'd like to give me a call or send me an email, I'll be happy to get you that contact information. And what will probably be our well, so we've got 15 minutes. I would say our last question. When you talk about dementia, someone mentioned dementia, and this question is that their mother gets very angry and they don't know how to manage through that anger. The mother has dementia and gets very angry sometimes, which is not normal. But how do you manage through that? What do they do when someone gets angry? Like, we've seen that, we've heard that before, that sometimes behavior can change. Suggestions, comments?
I
Jacqueline,
mean,
you want to start with
I've
or
been very lucky because I'm not facing that at this point, so I'm going to let her speak.
oh, I think being patient, trying to be empathetic. They're probably angry because, you know, they know that they're kind of losing their mind. I know that's like what happened with my grandma, and my aunt who took care of her took it very personally. It really took a toll on her. And through her support group, she just, kind of learned that I can't take it personally. It is just part of this process of dementia, and that just trying to be kind, trying to be patient, walk them through the anger. If they're able to voice why they're angry, have them talk it out, and just take a deep breath and know that it's going to pass. But when you're caught up in that moment, it's really difficult. Try not to get worked up.
Thank you. That's an excellent question, because people are frustrated who are going through that as well. We might get frustrated every now and then as caregivers, but the person who is not able to do what they used to do also has a level of frustration, and that they may act out. But there's something called careversations, not conversations, but careversations, where you're not always telling them, no, that's not right. You're not always challenging them. Just kind of go with the flow sometimes. Yeah, you're right. Even if it's sunny outside and they say it's a gloomy day, yes, it is kind of gloomy today, isn't it? Not always challenging everything that they say, and trying to correct them. but keep them social and keep the person as happy as possible. But when they come up with something or get angry, that can be a challenge. It can be a challenge if they're acting. This question says they're angry and aggressive, and so
Yeah,
that
I
that
would
oh, go
add on.
ahead.
I can add on the happy side more, but because of one of my mom's dearest friends was very had very severe dementia at the end, and she would be brought over by her husband, and she only passed away a few months ago, and she would tell me how great it was that she saw my dad at the farmer's market, and I would just say, "Great, what was he shopping for?" There's no need to tell her over and over. Her husband, meanwhile, would be like, Bill died, and I'm like, don't tell her that, it's fine, he's dead. I'd be like, no, just say like, oh, was he buying his favorite snow peas? But but no, I think the anger issue, I did one of my best friends again, because our parents all knew each other, and her mother was very angry at the end, and uh, didn't know who she was and thought she was out to kill her, and this really far gone, and it was really hard, and they just had to separate and say, that is not our mother, this is the illness taking over, and don't remember her this way, because of course she knows we weren't trying to kill her, we were there to take care.
Absolutely. Absolutely. And it is a challenge. And we have something, thank you for putting that in the chat, but music therapy is phenomenal. There's research, study after study after study that shows even people who have been somewhat comatose for a long time have been able to listen to music that they listened to when they were younger, and it just kind of calms them. So having music around or playing music, the music, not just the music that you like, but music that the person you're caring for enjoys is also very helpful. And ARP has something called Rhythm Circle. You can find it on our webpage where you can just join in and play. You can play a cup, you can play with a gentleman called Bujo who worked with Motown and all over, but playing instruments and just making noise kind of helps calm people down a little bit as well, and gives them something to think about other than the fact that they're angry, right? So that's another a way to help calm them. And sorry you're going through that. That aggression and that anger can really be disconcerting, but know that it's not personal, and it's just their mind is just in a different place. So best of wishes to all of you. There are some links that will be shared directly in the comments. Again, you can go to arpmi.org/care. There's tons of resources on that page as well. And we have just about 5 minutes left. So I'm going to ask both Donna and, I'm sorry, Representative Conlon. And I was looking at Donna, and Donna said sundowning music therapy is very helpful. Okay, thank you, Donna. Yes, but I'm going to ask Representative Conlon and also Dr. How to give some closing comments and advice and tips or words of encouragement to our listening audience. So we want to start, Dr. Howell?
Sure. Um, just if you are caring, remember, care for yourself. I think that's at any stage of your life. If you're, a new mom, in the workforce, starting a new job, or caring for an older adult, and still working, be nice to yourself, be patient. This is hard work. We are having, more and more people who are aging and less young people to probably take care of them. So, you know, be kind, be patient with yourself, make time for yourself, and ask for help. Don't try to do this. Try to be a big tough guy. Don't take too much on. Ask for help.
Excellent advice. Thank you. Thank you so much, Dr. Howell. Representative Conlon.
Yeah, I guess I would say a similar thing. I'm in the most privileged position of doing this. The house has space. My mother's been able to stay in the bedroom she's always been in. I mean, I am in the basement, but that's okay. but it's a nice basement, so we're fine. But and I've got the caregivers and some help with the cost and family nearby. So, but even though I've got all of that in place, which so many people don't,
Mhm.
I feel really guilty when I can't be home with her. Obviously, I have a big job and I have 92,000 constituents I'm also trying to take care of and be with them and be at their events and give them support. And so I feel like, oh gosh, I haven't seen her enough this week, or and And then I have to tell myself, don't feel guilty. You're doing everything you can. And she doesn't make me feel guilty. I mean, once in a while she'll say, that she hasn't seen me in a while, but I kind of try to pop up, even if it's like, if I'm between meetings all day, I'll just try to pop up and like bring her a cup of tea and see if we can make sure everything's okay. She's had a lot of colds this winter, so she hasn't been able to get out even the little amount she does get out. So it's been a difficult winter, but yes. And, I polish my own halo now and then because nobody else really does. So I have to say, look, you're doing everything you can. You're being a good daughter. And the nice thing is, not many people have this kind of time with their mom. And to be honest, so many of my friends whose parents live far away and they're flying there every 4 weeks to try to see them and take care of them or visit them in a nursing home. And I just go up a flight of stairs. So even though it's really difficult, it's also in some ways, I think, easier than for people who live really far away from family too, or not easier, different. But, just make sure. I had a toothache for 3 weeks. I only took care of this morning. So, you got to go in and make sure you're taking care of yourself, even when you don't have time. And, because that's not good either. Because if I'm sick, I can't take care of her. I can't take care of my constituents. I can't do anything I need to do. So there's that.
Yeah, absolutely. And go ahead.
Avoiding burnout, because if you're burnt out, you're not going to be taking care of you very well.
Absolutely, and you're obviously needed, and so you're needed in with your best self, not you being sick and someone else being sick as well or needing care as well. So thank you for that, and there's so many good resources that have been put into the chat for Laura and Veronica and Donna and Karina. Just great information. Thank you so much for listening. But please heed the advice. This is about caregivers. This is about not necessarily the person you're caring for, but about caregivers today. Resources that are available to you, everything from universal housing to respite care to whatever you might need. Ask for help. There was a senior vice president in our organization who was taking care of her mom, and she knew every single resource was available, but was too proud to ask for help. So, and she has since been on a journey to make certain that everybody ask for help. Don't be ashamed of that. And thank you for what you're doing. Whether your loved one can tell you thank you or not, I don't know, but we certainly want to thank you because you are the unsung heroes of this whole healthcare journey that you're on. And ARP, Michigan ARP in general is doing everything we possibly can to make certain that you get the kind of recognition and resources that you need, both at the state and federal level. So please stay tuned. Thank you for stay tuned in terms of the work that we do. Not stay tuned. This program's over, but stay tuned in terms of the work that we do because this is not a one and done. This program may be over, but the work continues. And don't hesitate to share your story. Again, in the chat, you can see where you can share your personal story. Every elected official we've spoken to at the national and the federal level has said, share your story, share your story. It makes a difference. Thank you for watching. And thank you, Dr. Howell. And thank you so much, Representative Collin, for the journeys that both of you have been on and for sharing that with us today.
Thank you for having me.
Thank you. Bye-bye.